During a meeting in Naivasha today, the Kenya Union of Clinical Officers has now sounded an alarm of an unlawful scheme under the Social Health Insurance Authority. Following a recent announcement by the clinical officers to down their tools and hold weekly demonstrations, the union claims that SHA is deliberately forcing clinical officers and other health workers to register their facilities with KMPDU, subjecting them to double licensure and taxation.
The motivation for these people to do this is that this money that is paid to the KMPDU illegally, they have a way of channeling it back to themselves, and they are benefiting from the proceeds of that corruption money.
According to the union, the authority's actions contradict the Social Health Act regulations, which provides that the authority shall empanel all licensed and certified healthcare providers and facilities based on lists submitted by relevant accredited bodies.
The Kenya Medical Practitioners and Dentist Council Act, where now we are being forced all of us to go and register by this board illegally, only provides for registration of facilities that are operated by medical officers and dentists. The law states clearly that facilities operated by the laboratory technicians are to be registered by the Kenya Medical Laboratory and Technicians Board. The facilities operated by clinical officers are to be registered and licensed by the Clinical Officers Council. The law is very clear.
The illegal policies, they say, have subjected clinical officers to pre-authorization for diagnostics and procedures under SHA, subjecting Kenyans to untold suffering.
And there are many facilities that have reached out to us. Many of them, they even fear coming out because they feel when they come out, they are going to be targeted and probably denied contracts. But when they are being paid, they are being made to part with what they are calling in quotes the 10%. You have to pay a bribe for you to be paid.
KUCO is now calling for the suspension of individuals involved in the development of these policies and urging Ethics and Anti-Corruption Commission to launch an immediate investigation. Gertrude Burgay, K24 TV.